But it's not over yet. I'm about to begin a new shift in an area that provides emergency care for over 500,000 people. Here I am at Stoke-on-Trent at an ambulance station. It's a new one for me. It's the beginning of a new day, and it's not as daunting now to be riding in the back of an ambulance, but I'm interested to see what Stoke has got to offer. Ambulance crews in Stoke-on-Trent help cover the whole of Staffordshire. It's an incredible 400 square miles and is sandwiched between two of Britain's largest cities, Manchester and Birmingham. I know now not to try and predict what kind of jobs that we're going to get, because you just never, ever know. It's 8 in the morning and I can't wait to meet my crew. So we're in the garage. There's a lot of ambulances here. It has to cover quite a wide area, Stoke. But all I've been given is the ambulance number.
4044.
Hello, 4044. Hello.
Hi, Steve.
Hi, Steve. Angela, nice to meet you.
Nice to meet you.
Hello.
Hiya.
Hiya. Hi, Liz. Nice to meet you. Steve is 54, is a fully qualified paramedic and has been in the service for 17 years. Liz is 47, is a community paramedic officer and has been in the service for 10 years. So you are my crew today on 4044. What can we expect from a typical day in Stoke?
Heart problems, chest pains, breathing problems, things of that nature.
With the local industry,
Right.
the old coal mines.
All right. So you've only been doing this for 5 years. What did you do previous to joining the service?
I've been on the service 10 years.
Right.
Prior to that, I was mostly in catering.
And do you just love it? Is this...
Yeah, I love patient contact, person contact. I just like talking to people.
Shall we book on and
Yeah, we're ready to go.
Yep.
and book out? As soon as Liz tells control we're available, an emergency call comes in.
044, yeah. What were you attending over?
Well, CC, 2 vehicles involved.
Yeah, do we know how many casualties over?
One patient with medical history and the police want to check it over.
Received, thank you. It's a request from the police to go and check a lady out who's been involved in a motor vehicle accident.
Oh, okay.
She's got medical history apparently, so it doesn't sound like a traumatic, it's more medical breathing problem.
Oh, right, okay.
But obviously it can always all change by the time we get there.
And how far away are we at the moment?
At least 10 miles.
Yeah, it's quite a way out, it's
Right.
10 miles, it's near the Shropshire border.
As we're speeding through the beautiful rolling hills and country roads of Stoke-on-Trent, I can't help thinking how all this contrasts with the fact that we could be facing a serious accident and terrible injuries. To get a true understanding of a typical day on an ambulance in Stoke-on-Trent, I've got a film crew following another paramedic and technician. Becky is 32, is a fully qualified paramedic and has been in the service for 5 years. Steve is 39, is a technician and has been in the service for 6 years. Staffordshire has a number of ambulance standby points strategically placed to enable emergency crews to get to incidents more quickly. Becky and Steve have been told to wait at one of 20 across the region.
We're covering all areas of the city, so when a job comes in, we should hopefully be within 5-minute distance of that job. We come here and we can cover. We're in Fenton, so it's like Fenton, Monton, Normacott, places like that. We'll be there within like 4 minutes, basically. That's the idea of them.
Becky and Steve only just settle in when they receive an emergency call.
Yeah.
43-year-old female with chest pain, car in front of you.
Can you tell me exactly what's happened?
Got a member staff with severe chest pain.
Is she changing colour?
She's very, very flushed.
Is she clammy?
Yes.
We're going to an infant store, but we're going to a teacher. It's a 43-year-old lady with chest pain.
Every ambulance service has response targets to hit, and West Midlands is no different. This particular call is a Category A, the highest grade of call, and means our crew has just 8 minutes to reach the scene. just over 6 minutes, Becky and Steve arrive at the school. I'm shadowing paramedics Steve Smith and Liz Needham as we travel to a road traffic collision, or RTC, over 18 miles southwest of Stoke on the Staffordshire border. When we arrive, the crash looks serious. Liz is wearing the minicam, providing a unique view of the action.
I gotta say, that's quite a nice bullseye on the car.
Someone's hit the windscreen there, it looks like. With a rapid response vehicle already in attendance, the driver of the crashed car is having her neck supported in the rear of a police vehicle.
Hey, sweetheart, my name's Liz.
The rapid responder, like Liz, thought the lady had knocked her head against the windscreen, but it looks as though the airbag has done the damage. Anne was driving on her way to work when she was involved in a collision with another vehicle. She's been left severely shaken by the accident.
Just hit me. I'm the next one. I've got airbag. Okay. Smell of burnout and the guy in the car behind me phoned the police. Okay, sweetheart. And that's where I am with it now.
Well, we'll get you to hospital, get you all checked out.
Just keep your head nice and still. Purely precautionary. So we just get a doctor just to check your spine out and make sure everything's okay. Any medical history at all, Anne?
I had a cerebral hemorrhage 4 years ago.
Did you? Just keep nice and still for me.
And I've got a clip.
Right.
It was here, behind here.
Okay.
And apart from that, now I'm absolutely fine.
Good. All right.
A bleed into the brain can be very serious and is concerning to Liz, who needs to be extra cautious.
Understandably, the adrenaline's been released into your system and you're like, your body's going at 100 miles an hour at the moment. Yeah? But what we do, because of that, it masks all the pain as well, which is brilliant. But on the negative side, it means obviously we don't know if you hurt anywhere. So Ruth is just going to keep your head nice and still for us until we get the board out. Okay. All right. It's a very strange sensation when you go on the board, but it's brilliant for your back. It's good back therapy. And if it's any consolation, we all have to go on a board when we do our training. All right, so we know what it's like.
Okay.
A spinal board is a device used by ambulance crews to provide rigid support during movement of a patient. And it's a piece of kit I've become very familiar with.
Purely precautionary, because say the adrenaline is kicking in at the moment. She doesn't really know if anything's hurting or not. So we will board her and keep her nice and still till the doctors exclude it.
Right, okay, cool.
And obviously the quicker we can get off the side of the road,
that's it,
the better.
Even with police controlling the flow of traffic, it's still a dangerous environment to work in.
Oh, thank you.
I'll go put it back.
So you don't move your head backwards and forwards.
Okay.
Just bending your knees. Just that's it. Right. What I'm going to do is I'm going to take control of your neck, just keeping so you don't move your head backwards and forwards.
Okay.
Just bending your knees. Well done.
Yeah, you can grab your head.
Okay. Now we're going to change. Now that's it. Swing your legs up there for me. Now you're going to get a beautiful view of the sky.
How's that? Slide down a bit.
All right. Any pain or anything here?
Not so far, no.
Okay.
Anne's clearly very upset.
Sim. You're all right, darling.
I'm not a crying person.
It's perfectly natural.
It's such a shock. I don't know how you're going to react when something like that happens. As Anne's taken to the ambulance, Liz is constantly comforting her.
How are you doing there? Okay. Off to sunny Stoke now.
Get you to the hospital in no time at all.
How are you starting to feel now?
I feel better now. I don't feel I want to cry.
Don't worry.
Liz and Steve check Anne's vital signs before setting off for the University Hospital of North Staffordshire. Coming up, we get a call to a school where a teacher has had a suspected heart attack.
What we'll do is just have a quick look at your heart now, okay?
And go to the aid of a toddler who's suffering from serious convulsions. I'm a few hours into an 8-hour shift in the city of Stoke-on-Trent, Staffordshire. Ambulance crews here help provide emergency care across an incredible 400 square miles. To get a true understanding of a typical day on an ambulance here in Stoke, I've got a film crew following one team while I shadow another.
What are CC2 vehicles involved?
Earlier, paramedic Becky Hughes and technician Steve Greatback were called to a primary school where a teacher is seriously unwell.
We're going to a teacher, it's a 43-year-old lady with chest pain.
2 rapid response paramedics are already treating the teacher, Michelle, who looks as if she's collapsed.
This is Michelle. Michelle's started with some left-sided chest pain this morning. It's not central. She has had it before. It tends to go up under her arm. She's on the floor, not because she's collapsed, just because this is where she feels most comfortable.
Right.
All right.
Michelle is suffering from acute pain down the left-hand side of her chest.
Any short breath? Certainly no nausea, has there?
No, just do it when I breathe.
So if you take a deep breath in, that increases, does it?
Becky tries to pinpoint a possible cause for the pain.
Any asthma, any breathing problems? No? Cough, cold symptoms, anything like that? No? No. OK. Have you pulled yourself any extra manual work than you would normally do recently? No? Does it increase if you press on it, does it?
Yeah, it does actually.
The verbal examination reveals no further clues to the cause of Michelle's pain, so Becky begins a physical investigation.
What we'll do is just have a quick look at your heart now, OK?
And we'll go from there.
Was it there this morning when you got up, or did it just come on suddenly?
It came on suddenly.
So, what were you doing when it came on?
I was just in the classroom, just singing with the children.
Oh. Everything's looking fine, OK. What we'll do now is take all this off you. We'll get you onto the ambulance.
Her basic heart trace result is normal, but Michelle is still in considerable pain.
That's it. That's it.
And how many episodes like this have you had?
I've probably had about 3, but not as bad as this.
Have you seen anybody about that?
No, I just thought it was probably indigestion or something.
Right, and switch. Stand you up. That's it. I'll pop you on that chair for a minute. We'll roll you out to the ambulance.
As it's not the first time Michelle has experienced this acute chest pain, Becky and Steve move her into the back of the ambulance, where they continue to search for the cause of the problem.
There we go. Right, and switch. We'll get you onto this bed, OK? Try and get yourself as comfy as possible on there. Right, we'll have to wire you all up again. There you go. How's the pain now?
It's not too bad, just when I go back.
So when you go back, it increases? Right. I've got a symbol. Your heart trace is completely fine. Yeah. So relief, eh?
Thankfully, a more detailed examination of the heart shows that it's perfectly normal. So Becky and Steve's attentions turn to the teacher's breathing.
It's a little bit more reduced on the left side. You're guarding yourself a little bit when you're breathing as well, because it's causing you pain, so it's quite difficult to listen to your breath sound.
If you have to score the pain out of 10, 10 being the worst pain ever, 0 being nothing.
So I'd say now, I would say about a good 7.
Right.
Like that.
An ambulance crew will try to avoid taking anyone to hospital if their symptoms are treatable at the scene. Frustratingly, the thorough examination hasn't shed any more light onto the cause of the pain.
So, with the fact that you've had this chest pain and it's caused you so much distress, then it's always a good idea to get it checked out, you know. They could do an X-ray or something just to make sure everything's OK.
As Becky and Steve take Michelle to hospital, 10 miles north in the centre of Stoke, we're travelling with our patient Anne, who needs medical attention after being involved in a car crash.
Roughly how fast would you have been going?
I just came over the brow of the hill, so I picked up speed. So I would have thought I'd probably by then be doing about 55, 60.
OK. Just gives the doctors an idea what to check for.
5 years ago, Anne suffered a cerebral hemorrhage caused by an aneurysm or abnormal bulging of one of the main arteries to her brain.
Because Anne's had the aneurysm before, does that mean you have to treat her? Is there a different way of treating her now?
No different way of treating her, but just little things to be a little bit more aware of.
Right.
Just be checking that Anne is feeling comfortable with her vision. There's no disturbed vision, any headache, audits, but then that goes hand in hand with what we would be checking anyway. For a car accident. You know, those airbags do go off at quite a force, and it's quite a smack in the face that you get.
I never realised that there was a fog. And the fog, there must be dust in the airbags.
Yeah, it's like a gunpowder. There's quite
that must have been so confusing.
It's surreal, really.
Are you all right there?
It sort of hurts my shoulder.
Is it? I'm afraid as the day progresses, as the adrenaline wears out of your system, you'll feel aches and pains.
It's sort of...
You didn't know that you could possibly have it.
It's kind of sort of at the back of my rib cage.
Okay. Try and think nice thoughts. You're doing really well.
You are doing incredibly well, honestly. They're not the smoothest of journeys, these.
Right, Anne. You'll be very pleased to know we are here.
And we're not the only ones to have arrived at the hospital.
No way our crew's here.
Parked up ahead is Becky and Steve's ambulance. With Anne safely into A&E receiving treatment, I want to catch a quick chat before they're called out again.
What job have you just dropped off?
We've been through primary school for a 43-year-old lady, school teacher, singing with the kids, and then suddenly developed left-sided chest pain. The pain was worse when she breathed in.
Which makes it muscular skeletal. Musculoskeletal.
Yeah.
I am learning so much about this. Good, well, she's in there. Our patient, Anne, is also in there. She had a crash in a car. She was an RTC. Becky, hiya.
Hiya.
You all right? Fancy meeting you here?
I know, yeah.
I've just been hearing, so it was a 43-year-old school teacher, and she had pain on her left-hand side. But...
Yeah, left-sided chest pain, yeah.
But does she seem all right as she's gone in?
Yeah, she seems fine. I presume they'll do like a chest X-ray and listen to her chest and stuff like that. So yeah, I mean, she's feeling a lot better than what she did anyway. So yeah.
All right, well, I'll let you book yourselves back on again. Maybe we'll meet again.
Okay. See you later.
As Becky and Steve head back out onto the road, a 999 call is received.
Tell me exactly what's happened.
A febrile convulsion in a 22-month-old.
Is she awake?
Yes.
Is she breathing?
Yes.
Okay, we are on our way to you.
Thank
All
you.
right.
And it's passed straight to Becky and Steve.
415 first, not making towards Norton, please. Doctor surgery, 9 Road, Norton. 22-month-old, please.
I know from my very first shift in Dudley, a call from a doctor's surgery can be very serious, especially when it involves a young child.
You have to sort of try not prejudge, don't you, with this job? You have to sort of just see what you get when you get there, kind of thing.
The surgery isn't far away, but as Steve and Becky have received no further updates, they've no idea what they're going to find.
We'll take the bag in. Hello.
This is Katie.
Katie.
Yeah.
Oh dear. Hello, Mum.
In the doctor's office, the toddler, Katie, is no longer fitting, but she's sitting up and
I
crying.
brought her back in. She was quite floppy. We stripped her off. Temp started coming down. Had temperature 40, but she's just a poorly child.
Katie's running a very high temperature and has had a severe fit.
We've got just down past the traffic lights there, and she's just full-blown convulsion. Right. Went off, you know.
Yeah, OK.
She needs to go to hospital where specialists will be able to investigate the cause of the fit.
Right, shall we take you out to the ambulance then? Yeah.
Soon see you better.
But in the meantime, Becky is keen to get Katie onto the ambulance, where she can give her some child-friendly paracetamol to help lower her body temperature.
Give you some medicine, shall we? Shall I take your temperature? 39.8. I'm sorry, sweetie.
A normal body temperature should be anywhere between 36 or 37 Celsius. Anything above 38 is a significant fever.
Right, Mum.
Katie, have some medicine.
Put it in her mouth and just like, it's just a syringe, so we just need to do the plunger.
Ready?
Ooh, is it nice?
Mmm.
Nice.
5 mil. Dad, 5 mil. Oh, all gone. That's it. Good girl. Strawberry flavoured.
As the medication begins to take effect, it turns out these fits are a common occurrence in Katie's family.
We've got 3 children under 4 and they've all had convulsions.
Have they?
So we've kind of got used to it, but when she has them, her eyes really go to the point where they're
Does she normally just have one at a time, or sometimes just...
Well, she just... A lot of what I call mini convulsions, where she's just juddering all the time, and then she'll have a really big one. The last one, like I say, was a big one, and it was went on about 6 minutes.
Are we okay? They are different to deal with because whereas an adult will tell you that they feel ill, that kind of thing, a child, they'll go along for a lot longer feeling ill without you realising that they're ill.
Yeah.
And so when you're ill, everything goes down quite quickly.
It can just suddenly change, can't
everything can suddenly change really quickly.
Yeah.
I think you get used to seeing them, but
I don't think everyone knows.
It gets more frightening.
It's not long before Katie arrives at the paediatric unit, where she'll undergo tests to find out what's causing her fits.
The temperature was that high that to get, because the body doesn't regulate the temperature, release the temperature properly when they're that small, that they have a fit to release some temperature basically.
Observe it for a few hours, won't we? And then hopefully she'll be back home with a bit of luck. Fingers crossed.
Coming up, I've got a whole lot more still to experience.
Just sit down here. Just sit for a minute. Just sit for a minute.
All you've got to do is check you out and then you can get on your way.
And the persistent caller who never wants to be treated.
So what are you going to do? Do you come in hospital? I'm not going to hospital.
Get out in the name of Jesus.
I'm in the middle of an 8-hour shift in Stoke-on-Trent, shadowing paramedic Steve Smith and community paramedic officer Liz Needham.
Now, that's it. Swing your legs up there for me.
We're outside the University Hospital of North Staffordshire, where Steve and Liz have agreed to show me a rather unusual life-saving device.
There's a new piece of kit that I've never seen before that I want to know a little bit more about.
This is the Lucas device, or the thumper as we call it. And
the thumper?
The thumper in Stoke or Staffordshire. So push that there over the patient's chest. And then if we want to start compressions...
So this?
Named after the Norwegian inventor's son, the Lucas device looks and sounds brutal, but this machine is helping save more lives than ever before.
So this is instead of doing manual compressions?
Doing manual compressions, your efficiency drops massively after 2 minutes. I think it's by about 70%.
Right.
Where the Lucas device, it keeps going for 20 minutes as long as the big O2s will last.
Yeah.
A recent report has found that by using this device, over 25% of patients were kept alive while en route to hospital, compared to the national average of just 15%. But where on earth do you get an idea to make a machine like this?
Bloke did CPR with a kitchen plunger.
No!
That cup
So he actually sucks the blood around as well.
and it physically moves the chest in and out.
So it's like...
That's why it's so efficient.
Oh no, now if I see anyone who drops down, I'll be going, who's got a plunger?
Get me a plumber.
Get me a plumber, yeah. It costs a fortune. Too expensive. Yeah, exactly.
Only won't turn up.
While we're waiting for an emergency call at the hospital, 5 miles away, I've got a film crew shadowing paramedic Becky Hughes and technician Steve Greatback. They're heading out of Stoke-on-Trent ambulance station on a Category A call.
This is one of our regular callers, I think.
Regular or frequent callers are people who've requested 999 assistance from the ambulance service on more than 5 occasions in 1 week.
Goes with it, chest pain, but...
Whether it is that we don't know until obviously we get there.
The West Midlands Ambulance Service received over 600 of these types of calls over the last 12 months. As they're travelling to the address, Steve and Becky receive more information.
Thank you. We are going to speak with police. Don't know whether they'll come out. They approach with caution. Any problems with door, please?
Yeah, Roger.
I think I've been here before. Yeah.
Becky and Steve proceed with caution.
Hello? What's going on today, mate?
Suffering diabetes, you know. I'm having an angina attack.
You're having an angina attack? You got chest pain then, yeah? Can we just slip your coat off? We need to do some checks on you.
Are you relative, are you?
No. Just a carer.
The man isn't home alone. His carer is around to provide a helping hand and to inform the crew of his problems.
Alcoholic.
Have
you had a drink today? Yeah. You have?
And how much have you had to drink today before we... So anything else?
2 bottles of whiskey.
2 bottles of whiskey? Jeez.
Usually 1.
It's 20 to 3 in the afternoon, but he's drunk 2 bottles of whiskey, and this isn't the first time today an ambulance has been out to see him.
Has the crew been out earlier? Right, that's today, yeah.
Today, you've had an ambulance out today already, have you?
Is that the early hours?
Right, just need to pop these dots on your chest, OK? Just undo your shirt for you. Oh, look at that.
Still on?
Yeah.
Right.
Dots are ready for us.
The patient has got the pads used to take a heart trace still stuck on his chest from the last visit.
Just press these on here.
The price of an average call-out is around £200, so attending to both emergency calls today is a significant cost.
Have you been sick at all?
Yeah.
Yeah. So with all this whiskey you're drinking... Oh, please. Just keep calm.
No problems.
It's the police officer.
Yeah, you're just attending as a precaution, that's all. OK.
Yeah, I don't think he wants to see you. He just says that's the police.
Is he all right?
Yeah, he's got some chest pain, but we checked him out and everything's OK.
Due to this patient's volatile past, the police check on Becky and Steve's welfare.
No need for that. Don't come in here. Come back when you've got a warrant. All right?
Okay. He's only come just to check that everything was OK with us.
Cool. There's no need for you to come in here. Get out of my house. Get out in the name of Jesus.
Keen not to aggravate matters, the police wait out of sight while Becky and Steve carry on treating the man's chest complaint.
So, have you still got the pain at the moment? Yeah.
So what are you going to do? Come in hospital?
I'm not going to hospital.
You're not going to hospital?
Why not? If you've got pain, chest pain.
Yeah, but once I've been checked out, that.
Becky and Steve believe the patient needs hospital treatment, but he has other ideas.
Don't you want to get it checked out if you're in pain? No. We need a signature off you if you're not coming to the hospital.
When a patient goes against the advice of an ambulance crew and refuses a visit to hospital, a patient report form has to be signed.
Just there. There. Are you sure you don't want to come to hospital?
No. Not going anywhere near the hospital.
Once the form is signed, Becky and Steve can leave knowing they've done everything they can to help.
You head to Stoke now, the ambulance station.
As they make their way back to Stoke Ambulance Station, I've beaten them to it and I'm already there.
We're just coming towards the end of our shift. We might not get called out on another call. But I've just heard that my other crew, Becky and Steve, are on their way. In fact, here they are. I couldn't have timed that any better.
I can't wait to hear what they think of these frequent callers.
Hi, guys. How are you?
Fine, thanks, you.
Yeah, good, not too bad. Station regular caller. This is a new thing that I never realised happened. So he's a regular caller that calls.
And doesn't want to travel to hospital.
Never wants to go to hospital. Just wants the checks doing.
Yeah.
Yeah, and that's what we tend to do, isn't it? Just do the obs. Ask him several times if he wants to go to hospital. He always flatly refuses.
Signs the form and off you go. How long did that take out of your day?
3/4 of an hour.
Yeah. 45 minutes. 45 minutes.
Yeah.
And how often does he call?
It's his second time today.
Right.
He called, I think it was about midnight.
And how do you feel about these regular callers?
You have to go with a professional attitude, but sometimes when you go in and he's drunk and he's swearing and shouting and the rest of it, and you do feel a bit like,
yeah.
But
you never know, one day.
Well, that's it. Yeah, he could be having a heart attack one day and we have to be professional.
But do you know what? I always just think about the potential other patients that you might be close to who really, really need an ambulance, who have to have an ambulance that comes from further away because you're tied up for 45 minutes. 45 minutes is a long time for if someone's in cardiac arrest or if someone's drowned or if someone's in a car crash.
On one hand, it's quite, you're like, oh, quite irritated, and then on the other hand, you feel sorry for them as well.
So it's really sad and
that they haven't got anybody.
Coming up, we go to the aid of a man who suffered a suspected epileptic fit, but doesn't want our help.
He's gone off. Oh well, well.
Anywhere you like, sir.
And I meet an unsung part of the ambulance service who help over 700 patients a week.
Call them the old ones, because I've been going with him that long. Don't stop me, you know what I'm like when I get
Yeah, I've got a live one here.
I'm nearing the end of my shift with the Staffordshire section of the West Midlands Ambulance Service. So far, I've been with the paramedics as we attend a road traffic collision.
I'm going to take control of your neck, just keep him so that you don't move your head backwards and forwards. Okay.
A suspected heart attack.
What we'll do is just have a quick look at your heart now, okay?
And a very sick little girl. In Stoke city centre, paramedic Becky Hughes is back on call, but this time with a new crew member, Graham Dale. Graham is 48 and is a technician. He's been in the service for 10 years. Almost as soon as Becky and Graham are on duty, they receive an emergency call.
All we've got is somebody there that's sitting.
Do we know male, female or anything like that?
Next shift.
Yeah, Roger, thank you for that. All we've got is there's a patient fitting with a convulsion outside of the nursing home.
Police run scene.
Within minutes, they arrive at the scene and are met with a man who's collapsed in the street.
Yes, you. Hiya.
Alright.
See where you are a minute, sugar body. Your brother does suffer from epilepsy.
Says he suffers from epilepsy.
Go on, sweet.
Okay.
He suffers with epilepsy, as far as we're aware. And when they come round from a fit, they can be very confused, very combative at times, very aggressive.
No, come this way.
Although not aggressive, the man is very confused and in danger of dragging Becky into the traffic.
Well, just come and sort yourself out in here for a bit then, first.
This way.
The man is obviously not well, but doesn't want to get into the ambulance.
You need to.
You need to check you out. You need to check you out. Go with us.
It's not safe to go outside on his own.
Although he appears to have had a fit, it also looks like he's had a drink as well.
Yeah, he smells of alcohol.
Despite the crew's best efforts to take care of him, he's having none of it, and he walks away.
You've got a head injury, your head's bleeding at the back, you've grazed it at the front, you've got a lump at the front.
You need checking out.
You're staggering.
Go with them, and that's best option, yeah?
All we've got to do is check you out, and then you can get on your way. What we think has happened, the call's come through as a fitting. The gentleman's been found on the floor by passers-by in the cars. It's one of them reportedly was shaking, so whether it queries and fit. It also smells of alcohol. Whether it be that he's drunk and disorientated or whether he's had a fit, that's why he's disorientated. It's difficult to say. He's not with it, so that's why he's acting like this. He doesn't seem to be aware of what's going on.
Unable to get him into the ambulance, Becky tries to find out what's wrong with him in the street.
Have you ever had a fit before? Yeah. Well, obviously, we've never met you before, so just for like, you know, I know you put up with it, and that's fair enough, but to cover our backs and to cover police's backs and everything, we need to check you over, okay? So a lot less trouble if you just walk back to that ambulance with us, we'll check you over, and then we can take it from there. You're not thinking sensibly.
Finally, it looks like he's come to his senses, and he goes back to the ambulance.
We need to check you over, and if everything's okay, you can go home then, can't you?
But then he changes his mind again and carries on walking.
He's gone off.
It goes against all their training. They've no choice but to let him go.
Oh well.
Are you happy for him to go?
Well, there's nothing they can actually do.
Yeah, okay.
Because he's not completely out of it, that kind of thing. He's got the capacity, it's his own decision to do what he wants. It's
not ideal, is it?
It's not ideal, no, but we can't force him onto the ambulance. He's got his own free will.
Back at the station, I catch up with a section of the ambulance service that not only helps save lives, but also helps improve quality of life.
So which is your vehicle?
Straight ahead.
This one here, right.
It's the Staffordshire Passenger Transport Service, or PTS. My crew are John and Bryn, who are part of a 90-strong dedicated team whose duty it is to transport patients to and from their homes to receive the vital ongoing treatment at hospital.
Anywhere you like, sir.
In North Staffordshire alone, there are 750 patients who rely on this service every day, 7 days a week.
Hi, Mary. How are you today? Hey, Phil?
Yeah. Cheers, darling.
The whole thing has a feel of friends greeting each other. Today, we're collecting patients who are all suffering from kidney failure and need life-saving dialysis at a hospital's renal unit.
How often do you get picked up by them then?
Oh, I get picked up 3 times a week. Tuesday, Thursday and a Saturday. We call them the old ones, but they're not really old. They're young men, aren't they, really? But we call them the old ones because I've been going with him that long. It's the old.
What's that?
Don't start me, you know what I'm like when I get going.
Yeah, I've got a live one here.
I don't want another good one.
Making the patients feel at ease is the secret of this job, and it's one that these crews seem to excel at.
Normally the patients we pick up are very anxious and concerned about getting on time for their appointment. So we just reassure them, get them there as safely and as quickly as possible, so that all the anxiety is taken off.
How vital is this service for you if the PTS wasn't here, for example?
Quite honestly, it's keeping me alive, isn't it? I've got 2 great-granddaughters, Angela, one's 3. She says to me, are you going to have your batteries charged again, Nana?
Oh, to get your batteries charged?
Yeah, get my batteries charged.
We arrive at the Royal Infirmary in plenty of time for Mary and Phyllis to start their treatment. With over 100 patients being transported to and from the 3 renal hospitals in the North Staffordshire area, keeping them on schedule is vital.
I mean, it shows that actually, you know, with the amount of people that come in and out, if a patient is late.
It affects all our shifts in here.
To make sure that the patients that
are in on time is really important.
It's essential.
It is.
It's essential.
So, we blame them.
With time obviously critical, we can't stand around and chat anymore. So it's back on the road again to pick up the next batch of patients. And for the crew, they love it.
You always get a sense of worth out of doing this job.
Yeah.
Always.
My shift today has been a roller coaster of emotions, but the feel-good factor certainly kicked in when a couple of weeks later I caught up with some of the patients we helped treat. First was Anne, who'd been in the road traffic collision.
Any medical history at all, Anne?
I had a cerebral hemorrhage 4 years ago.
Did you?
I had a cerebral hemorrhage. I got like an aneurysm in an artery in my brain, and it was leaking blood into my brain. On impact, my initial thought was, I must have banged my head, oh, am I going to die here? And then I sort of sat back and thought for half a second, no, I'm all right.
Alfie, come on, old man, come on.
When my husband brought me back from the hospital, I had pains in my neck, whiplash injuries for about 5 days. But I was fine. After rest, after a couple of days, I felt a lot better.
Anne is now fully recovered, but her husband's taken steps to further protect her the next time she goes out driving.
My husband's bought me a big car now. He said I need a bit more metal around me next time. So I have got a bit more metal around me this time.
Next was Michelle, the primary school teacher. She'd suffered severe chest pains during morning assembly.
As I was singing with the children, I started to get a sharp pain in my side here, and it was sort of like
like digging through to my chest.
What we'll do is just have a quick look at your heart now, okay?
Presumed I thought I was having a heart attack, and I was in that much pain. I just got tears streaming down my face.
Once in the ambulance, the crew tried to find out what was wrong with Michelle. It was the same when she got to hospital.
I was in hospital for about four or 5 hours. The doctor did say to me that they couldn't find anything wrong with the heart, which was good. But she did say that it could have been a number of things. She said it could have probably been like a muscle spasm.
Now back at home, Michelle follows the doctor's advice in case the muscle spasms again.
So obviously there's nothing, you can take for that. You've just got to, posture yourself better and, look after yourself.
Finally, there was baby Katie, who'd been having a fit at a local doctor's.
When the paramedics arrived, it was just relief, really, knowing that everyone who could deal with it was there.
Katie was immediately rushed into the ambulance, but for her mum Patricia, it was all a bit of a blur.
I can remember just holding her in my arms. She was very tired, very, very dopey. She just wasn't very happy. She'd come round, but she was just very dopey and very sad.
At the hospital, she was diagnosed as having a fit that was brought on by a severe bout of tonsillitis.
I was told that with Katie, any rise of temperature now, she has to see a GP. She should grow out of the convulsions, and they did say that if she continues to get tonsillitis, I think it's 4 times within a year, then they would look at removing them.
But for now, Katie is fully recovered and bouncing around like any normal 2-year-old.
Round and round.